I chose to become a pharmacist because pharmacists are at the center of their community. It's something I did even as a high schooler, and I wanted a profession that was still an integral part of their community. One of the most memorable stories that I can remember, I had a patient who was on well over 24 medications. In fact, if I remember correctly, she was taking 27 or 28 different medications. And after she reviewed all of her medications, I asked how she kept track of each of her medications. I said, tell me about your daily routine. What do you do? How do you organize these medications to make sure that you're taking them correctly on a daily basis? And she explained that because she was taking so many tablets on a daily basis, that when she woke up first thing in the morning, she would make a morning smoothie, take all of her morning medications and throw them in the blender so she could get it done all at once. Her medications included several extended release products, and that was a big concern. In reviewing some of the disease states that she had, in addition to some of the conditions that she was treating, she experienced migraines on a daily basis. She had very frequent seizures, and she was being managed for that. When we stopped putting her medications in the blender, and we stopped that immediately, within a month her medication list went down from 27 or 28 to somewhere between 12 and 15. She was not experiencing daily seizures or daily migraines, and she also wasn't having seizures on that regular basis that she was having. And so it made a world of difference. She went from being completely disabled on a daily basis to having her life back and having a much greater quality of life, in addition to taking fewer medications and having a better control of her chronic disease states. As a pharmacist that works within an insurance company, we get to serve our patients in a unique way. We have access to their fill history, and so we can ensure that there is true compliance. We also have access to their formularies, and so if patients have questions or concerns as to other medications that are available that would be covered or more affordable, we can help them navigate through their formularies to make decisions that would help them with the best care. We also do follow up with their providers, so we work together as a team to make sure that they're getting the best care possible. And the other great part about what we do is because we use the telephone, we're reaching out to patients all throughout the plan that it covers. So we have our patients in well-populated areas, as well as patients who are in very remote areas. I've had a patient who told me their closest neighbor was 90 minutes away, and so that really makes a difference. It's important for pharmacists to be recognized as providers because we're the most accessible healthcare professionals. And I don't think that you can let go of how important that really is. We're the face of the healthcare profession in a lot of senses because we're the ones that patients can access, regardless of the time of night. They don't need to wait in long lines. They can get to a pharmacist. And the care that pharmacists provide, whether it's helping to save money, helping them to understand their medications better, they all improve patient care and reduce costs in the healthcare system. And that's a big component of being a team player within the healthcare system.